Hello all, it's me Abhilash Vijay Mohanan Nair from Be Good Academy. So now here we are on this virtual platform with yet another interesting roleplay presentation. With me today we have got Joel sir with us.
Hi all, I'm Joel Burgess.
Yes, see now our roleplay is here on a dog bite and following our suturing we are doing. So we are going to deal with the patient with the dog bite suturing. Overall this topic can be taken as a non-case, so there is no confusion about it. We know the patient and we are going to deal with them. Now you can have a look onto the screen, so we'll be displaying the questions right over there. Hope all our students and aspirants have gone through the question. So Joel, how do you feel about the question?
Yeah, I feel like it is not much of a challenge because I think on first notice you can understand what needs to be done. You just need to provide some basic instructions.
It's quite easy, right?
It is quite so. Okay. So I hope you will also be able to look.
They'll be really enjoying this role play.
That is right. Okay, so let's jump right in and see how this can be done.
Yeah. So the role play, the setting here in this role play is an emergency department. I'll be playing the role of nurse and Joel sir will be playing the role of an interlocutor. Shall we start, Joel?
Yes, sure. Okay, your 3 minutes are up. Okay, and you can assume the name of the patient as Joel, as it is the name of your interlocutor. Shall we begin?
Sure.
Let's go.
Yes, Mr. Joel, it's done. The suturing is over. Now you may please feel comfortable. Okay, well, how are you feeling?
Yes, after this suture has been provided, I'm still experiencing some soreness and pain.
Okay,
is
you
it
have got
unusual?
soreness and pain? Oh, that's usual. You don't have to worry. It will go away by itself. Okay, so
Okay.
we'll be doing further management and treatment. Well, before I'm here to give you some instructions regarding wound care. Do you have any idea on how to take care of your wound?
Unfortunately not. I've not suffered or sustained such injuries in the past.
Well, you don't have to worry. I'm here to give you detailed information regarding on how to take care of wound, and especially you have to take a great care because it's somewhat quite serious dog bite injury.
Okay.
Okay, Joel, so no worries. It is very easy to manage the wound. But there are certain instructions by which you can keep yourself safe and comfortable. Okay. Firstly, when it comes to wound, as usual, you need to take a great care because the dressing should be kept on.
Okay.
It should be dry, clean, and never allow it to be wet or soil. Because wound contamination can result in serious infections. Okay, fine. So please tell me what kind of job you do because you have got an injury on your right hand.
Yes, nurse. I'm actually a librarian.
You're a librarian.
That is
and
right.
you've got much effort with your right hand. You're dominant with your right hand, right?
That is correct.
Yes. For first few days, you have to take an extra care because these are the days that aids healing. Okay, you need to take a great care so that it will heal properly.
Sure.
In case if you feel like the wound is contaminated or it gets soiled or dirty, make sure that you're changing it. Okay. Otherwise, never go for opening the wound. It should be kept close and covered. Okay, opening of wound may result, opening of this dressing or wound dressing may result in some sort of serious infection. Okay, so make sure that wound is kept intact by having a close covering of the wound.
Okay. So how exactly can I do that? Like, I have no idea about the wound dressing.
Firstly, now we will be doing wound dressing here. So once in a while, after 3 days, you can come here back again, or you can go to a home health care center nearby your home and can get the dressing done for you.
That sounds great.
Well, Joel, since the wound is on your right hand, I would strongly suggest you to go for sling use. Do you have any idea or have you heard about sling use?
No, what is this thing? How is it going to help me?
So sling, it's a comfort device by which you can accelerate your healing. You can apply it over your dressing so that the wound will be kept intact and covered. Okay. In case of any movements also, sling prevents alteration of wound dressing. Okay. So you can, that will add to your comfort and make your healing process much easier.
That's excellent. I'm much more relieved right now.
Okay. It aids in better protection also. Okay. So that you will be more comfortable with that and also prevents swelling and adds to the protection of your wound. Wound will be more secure if you use sling.
Sure thing, nurse.
It seems something is bothering you. Are you concerned? Please tell me.
Yes, I'm glad that you noticed because I've been a little worried about the impact any sort of infections could have on my wound healing.
There is nothing to be overly concerned about. See, now you're safe. Okay, wound cleansing has been done. Okay, the dressing is on, and soon we'll start antibiotic therapy. Okay, doctor will give you prescriptions for antibiotics. It will be usually there for a 7-day course. Okay, the thing is that you need to continue the course. You need to finish the course of antibiotics. Okay, never skip the medications. And I need to confirm one thing. Have you updated your tetanus vaccinations?
Well, not anytime recently.
So you're not sure about your tetanus injection, right? So I'll make necessary arrangements here in our vaccination room. You can go and consult them. In case if needed, they will update the tetanus vaccination for you. Okay, that is some sort of booster that will help you from some sort of severe infections like tetanus. Fine. Are you comfortable?
Yes, I am.
And yes, since you're concerned on infection, as I told you, are safe. There is nothing to be worried about. Yeah. But there are certain signs and symptoms that you need to take care of. Okay,
sure.
Make sure that you have a close watch over your wound. Okay, in case if you experience some increased temperature, elevated temperature, fever, or if there is swelling or pain, increased pain. Okay, if it is not getting better day by day, if you experience all the symptoms in high, make sure that you're quite vigilant. Fine.
Yes.
And if you notice something like pussy discharge, oozing, leakage, or feeling heat in skin, or if you're feeling fever or some other symptoms like that, never delay, get back to us immediately. Okay, this could be some sort of warning signs before infection, so that we can act accordingly if you present yourself in case if you notice all these signs and symptoms. Fine.
Yes, I'll try to follow your instructions.
That's great, Mr. Joel. Well, do you have any other queries for me?
Yes, I was hoping you could tell me more regarding my stitches and if there is any additional care I need to provide for the same.
When it comes to your stitch, it is usual to remove within 7 days. By next follow-up, I hope doctor will give permission for removing the stitches. Fine.
Okay. I need to come back for removal. I've heard of stitches that can dissolve by themselves. Why couldn't you have just provided me with those?
Oh, I really appreciate your concern. I know that you're very much vigilant and highly concerned regarding your condition. Yes, in your case, it's not a self-absorbable suture. Fine. This is a kind of suture that should be removed. As I mentioned, your wound is a bit serious. It's more deep, so it requires more strength. Okay. Wound should be more indirect. Fine. Yes. In case if this is not applied, there would be risk of opening wound by self, evisceration, dehiscence, I think you have heard of. So in order to prevent all those of wound complication, this sort of removable sutures are applied. So that we can have a careful evaluation, close observation, and in case if needed, we may continue with the suture too. That's it. But in your case, there is nothing to be overly concerned about. There is no worries, no chance of any, there is no risk detected so far. You can definitely go for wound removal within 7 days. You can come to us. Fine. Okay, so that you can have your follow-up done, and doctor will give further information and instruction regarding how to take care of your health in future for the management.
Absolutely.
Fine.
Yes.
Okay. Is there anything else that you wish to ask or discuss?
No, I think you've given me a comprehensive idea about everything I need to follow.
So I hope you're very confident.
Yes, nurse.
Hope I have assuaged all your concerns.
Indeed.
Will you be able to manage by yourself?
Yes, nurse. I feel much more confident.
So you're happy
right
going
now.
back home?
Certainly.
Yes. Now we'll give prescriptions for medications, and the doctor will give further information and instructions regarding your further care. Fine.
Yes.
It was really a pleasure meeting you. Thank you for your cooperation. It was really a pleasure talking to you.
Thank you very much.
Take
nurse.
care.
Sure thing. So I hope you learned something new from the role play video that we just presented.
I feel like that was quite somewhat interesting.
Yes, indeed. And I guess some people might have some concerns about why we didn't provide any greetings.
Yes, okay, that's an obvious concern from our students. See, this role play is given in such a format, like in a known manner, this role play is given like, okay, because it says, our first task itself says like, confirm the treatment process is over. That means the suturing is done.
Yes.
In that case, both nurse and the patient is known to each other.
That is
their own known case. So there is no confusion about it, that good morning or some other wishes or introduction doesn't make any sense. So you can just directly start the role play like, yes, it's over. So you just think in your native balance, in your normal work area, how you'll be behaving, the same sort of dialogue that you can give here, just like, yes, it's over, Mr. Joel, the suturing is done.
Yes.
Well, you may feel comfortable now. Hope you're relaxed. Any other discomforts you have?
Yeah.
So that would be the some sort of in a natural sense that we could convey the dialogues. And
That is right.
yes.
So I hope this.
Any other
role play was
concern,
good for you.
Joel, the student may feel like asking? What do you feel about this role play? Generally, it is quite easy. Somewhat there is nothing
Yeah.
confusing, right?
That is right. That is right.
Okay.
I think the only thing that they need to worry about is about how to reassure the patient
Yes,
about the
right.
care they need to provide, and just make sure that they have an idea about the process
It's
that they
quite
need to
vivid.
follow.
All these points, tasks are given in a clear format, so there is nothing to worry about. So you can follow this format, and you can develop your language skills by yourself. What you need to focus is like intonation. You need to address the concern in that pace. The talk, everything should be modified like that.
That is right.
So there is, I think, there is nothing to be, nothing more confusing or nothing there to discuss about, right? In case if you feel like some queries, you could put it in the comment box, and during our next session, we'll be able to clarify that. Fine, thank you for joining with us. So stay tuned. We'll be coming with more role plays.
Thank you.
Thank you.